We want to bring in Secretary of Health and Human Services and former orthopedic doctor himself, Dr. Tom Price. Secretary, it's good to have you on the program. Thanks so much for joining us.
Thank you. Wonderful to be back with you.
Let me ask you about your thoughts on these numbers as you see how people feel about a repeal and replace, and as we see these efforts to come up with something solid in these next couple of weeks.
Well, I think what you see is just a shot in time, a snapshot in time. The fact of the matter is the American people understand that our current health care system for those in the individual and small group market, that exchange market, simply isn't working. You've got premiums that are up. You've got deductibles that are up. You've got a third of the counties in this nation that only have one insurance issuer providing coverage. That's a system that's not working for patients. It may be working for government, but it's not working for patients. So what the president has done, I think, masterfully, is to set the table for really remarkable success as we move forward with health reform. And we're going to get it done. We're going to get it done because it's the right thing for the American people.
So I want to ask you about the president's first 100 days in office. Obviously, you've had a lot of victories yourself. But first, before we go into those accomplishments, what do you think is most important with this health care bill? Do you think we will have something on the floor in the next couple of weeks?
I think so, because everybody understands in the majority that the system right now isn't working. And they know that we need a Medicaid system that works for the Medicaid recipient. We need an exchange system for the individual and small group market that works, that's bringing down premiums, that's making it so that folks can actually see their own doctor and get the kind of treatment that they want and that they need. And currently that's not the case. And so I think that folks will coalesce around a very positive plan, a plan that, as the president has said, will bring down premiums, will make it so that deductibles aren't skyrocketing and off the roof, so that people have insurance cards but they don't have coverage. That's a system, again, that doesn't work for patients, and we're going to change that, make certain that we're responding to the needs of the American people.
Much of the coverage obviously has focused on what's happening in Congress and whether or not the votes are there for this bill. Meanwhile, you've been accomplishing a lot of things during these early days when it comes to opioids, when it comes to other issues. I mean, the opioid is actually a crisis. Can you walk us through how you see these first 100 days when it comes to health and human services?
Yeah, again, I think that the president has really done a remarkable job in coalescing and bringing folks in, pulling folks in, and letting them appreciate what his vision is for the entire health care system. At the same time, what he's done is instructed us through this department to focus on a number of items. One is to get the kind of flexibility at the state level that's so necessary for folks to be able to have the kind of health care system that they want. And we've worked with states like from Alaska to Florida to bring about the kind of flexibility in their system so that they can respond to their constituents. The president also has identified some real priorities. One of them, as you mentioned, is the opioid crisis. This is a scourge that knows no boundaries whatsoever. It cuts across all sectors of our society. We had over 52,000 overdose deaths in 2015, the last year where we have statistics. 33,000 of those from the opioid crisis. This is absolutely unacceptable for our nation. So what we've tried to do is to work with stakeholders out there, work with the folks who are in the communities and understand the challenge that we have. We've worked with Congress and the resources that they brought to bear. We're working with states right now to bring over $485 million in grants so that we can begin to put greater focus on the challenge in the opioid area. We're working through the NIH to make certain that we're doing all that we can from a research standpoint to see how we can come up with drugs that stop pain, but they don't cause the kind of euphoric effect that the opioids do, so that we can solve this remarkable pain challenge and crisis or opioid crisis that we have. That's front and center right now for the American people, and the president understands this, and he's been challenging us to make certain that we solve it.